My name is David Armstrong, and I'm the Director of the Health Workforce Technical Assistance Center. Now, this webinar is entitled Innovative Dental Hygiene Practice, Community-Based Oral Healthcare Services in Oregon and Minnesota. Now, with that said, I'm going to go ahead and turn this event over to our moderator, Jean Moore. Jean, would you like to introduce today's panelists?
Thanks, Dave. Hi, everyone. So today's session is titled Innovative Dental Hygiene Practice, Community-Based Oral Health Services in Oregon and Minnesota. The presenters for today are Lisa Balint, who is an expanded practice dental hygienist working at Capital Dental Care in Oregon, Nicole Ferrian, who is a Clinical Innovation Center at Apple Tree Dental in Minnesota. And then we have a discussant or reactor, Donna Hickey, who is Vice President of Governmental Affairs and Public Policy at the Dental Hygiene Association of New York. You know, I want to give people some context for this. So some of you may have been at our last webinar a couple weeks ago called Variation in Dental Hygiene Scope of Practice, Why It Matters, and kind of built the framework for this session, where we want to look at some places that are doing some pretty innovative things in the area of dental hygiene that actually ties to having a broader scope of practice. So let me just tell you who all is sponsoring the session today. So first, the Oral Health Workforce Research Center. We have done a lot of work in the area of dental hygiene scope of practice, and we're just delighted to be able to support this effort. So the sponsoring entity, the Health Workforce Technical Assistance Center, is really helping us to get this message out to as many people as possible. And another sponsor of this is the Schuyler Center for Analysis and Advocacy. As many of you know, the Schuyler Center got a grant through CareQuest on future oral health workforce, oral health equity through workforce design. So again, I think that we recognize that understanding the roles that the health workforce can play in creating access to oral health services is absolutely critical. And again, we want to start with dental hygiene. So I just wanted to put this up as a reminder that, you know, this was our starting point from last week, but it's really a great opportunity to understand or kind of put this into action and understand what hygienists are doing in states that support a broad scope of practice. So next slide, we will start with a presentation by Lisa.
All right, well, thank you for introducing me. Once again, my name is Lisa Balint. I am an expanded practice dental hygienist with Capital Dental Care's community outreach team. My broad scope of practice really allows me to work in multiple community outreach settings, community-based settings, and this just helps me to address some of the barriers to care, barriers to accessing care that my patients face in rural settings, quite a different bit of areas that we go to. And today I'm just going to tell you about a little bit of Capital Dental Care and how we get to do what we get to do, what that scope of practice really looks like for me in particular, and how that has allowed me to and our team to go into completely different settings and bring care to where our patients work, live, play. If you go ahead and move that slide forward, thank you. So just to give you a little understanding of who we are, Capital Dental Care is one of the largest Medicaid providers of dental care here in the state of Oregon. We have many partnerships with different care coordination organizations, about 10 out of the 16 in Oregon, who oversee our Medicaid population. We serve in excess of about 360,000 patients that are on the Oregon Health Plan or our Medicaid. And we operate an extensive dental outreach program in multiple non-traditional settings, like what we call co-locations. This includes school-based health centers, primary care clinics, mental health facilities, hospital settings, quite a few different areas. We also deliver preventive and restorative dental care within our traditional clinics as well. Those are affiliated with either like our Smile Keepers offices or our general dental offices, and those are located all over Oregon, Washington. Our mission is committed to preventing dental disease and improving the oral and systemic health of children in low-income families. We create access to quality care. We use evidence-based methods and provide dental leadership within the communities that we serve. You can go ahead and advance that slide, please. So something about Capital Dental Care is we take a strong responsibility for our Capital Dental members. I'm not going to go into too much detail about how that all works, but the members that we see that are on Medicaid, they are assigned to us, and we take full responsibility for that. So this is looking at the quadruple aim, what we are hoping to achieve with a more human-centered approach to how we address dental health. So this is the quadruple aim: better patient experience, better health outcomes, better team experience, and while also hoping to reduce those costs associated. We can go ahead and move to our next slide. So getting into kind of the nitty-gritty about what we do. So we provide dental access through the help of teledentistry and really through medical dental integration. So I want to talk a little bit about our community outreach team. I made this little infographic to kind of show you some of those aspects of where we serve. It would take me a very long time to go through and really thoroughly explain each of those. So I'm just going to give you a little bit of an idea. At these locations, sorry, if you want to put it back over to the next slide. We use portable or mobile dental units with outreach team members that include our community health workers, our expanded practice dental hygienists, our dental therapists, our mobile dentists, and our teledentistry service are also offered. And we work in all of these non-traditional settings because we kind of have to adapt to each of them. You know, sometimes portable equipment is going to be best. Sometimes bringing a dental van is best. Sometimes we can just operate with the equipment that's already there. And teledentistry is kind of what bridges the gap between this because it allows us to do more. We are able to collect that data on the ground and then bring it back to our teledentist who helps with that process and the decision-making process, and then be able to get those patients care coordinated where they need to be. So I'm going to go to the next slide. It's going to look familiar. Thank you so much. So how is it possible that we can care in these locations? Well, how can a hygienist do all the things without a dentist present? It's because of our scope of practice. I just want to briefly share this slide, which demonstrates the broad scope of practice dental hygienists have in Oregon. This is such a helpful visual. I so appreciate the Oral Health Workforce Research Center in New York for creating this and also continuing to update it. It's a fantastic infographic. As you can see here in Oregon, we have one of the broadest scope of practices. It's allowed us to increase access to care for sure for our populations. With our expanded practice permit, as hygienists, we can complete a dental hygiene diagnosis, create comprehensive treatment plans, prescribe prophylactic antibiotics, supervise dental assistance, provide sealants, cavity stabilization through like placement of Fuji triage, silver diamine fluoride. We could also provide some local anesthesia. In an office with a dentist present, we can also do nitrous if we have our nitrous permit. This just allows us to do more, right? And then let's go ahead to our next slide, and that just kind of shows us a little bit more of what that looks like. This is kind of, I just summarized some of the main services that we provide in most of our locations. Now, in some of our locations, our provision of services, maybe if we're working at, say, a medical office is going to be limit to their workflow, correct? And so that might look like oral hygiene instructions and fluoride applications and care coordination. And that's what we do. And some of them, we may have more space. So we can do full dental hygiene services, x-rays, periodontal charting, and do a teledentistry visit in that moment, or care coordinate if there's signs of cavities present. So yeah, that's kind of what we can do, which is pretty amazing. I don't think I knew how amazing this was until I presented at NOHC, and I was like, wow, we really are doing some pretty cool stuff, and we're pretty lucky that we get to. Moving to our next one, our next slide. So this is kind of the flow. Oh, I don't know if that's showing up for you.
No.
Oh, I'm so sorry. Oh, it's coming. Maybe click a few more times. I think it's, yes. I forgot we put that on there. All right, so this is kind of what it looks like for our integrated dental home. So when we are working through teledentistry, you can see our lovely little cloud there. That's our cloud-based electronic health system. It talks about a little bit about our workflow. Now, I feel like that's a key thing that a lot of people ask me about. Tell me your workflow so we can implement it right now. Workflow is different based on each location. And it really takes a mindset of being able to be adaptable. So for one of my locations, this looks different than another. But this gives you kind of a broad idea of how we work as an expanded practice hygienist and what that looks like. You know, I'm essentially doing an on-site intake. I'm collecting all of the data. I'm sending that to my teledentist. I'm coming up with a comprehensive dental hygiene diagnosis and treatment plan and getting them set up for that. And then I'm connecting them, whether it's with a teledentist, if there's no obvious needs present, or I'm connecting them with a local brick and mortar office for more hands-on dentistry for that. And so that kind of shows a little bit about what that looks like. And how that flows. It also shows a little tidbit, and right in the heart, right in the middle, which is exactly where they should be, are community health workers and the amazing work that they do and how they really come in when it comes to our care coordination. So a big aspect of what we do is we know that we're facing and serving populations that face a multitude of barriers, whether that's transportation barriers, language barriers, cultural barriers, financial barriers, whatever it may be. Our community health workers help with that. I see a question about what is our cloud-based EHR do we use? We use Denticon right now. We've used Open Dental in the past. And that's been helpful to be able to communicate that. We've had other programs before, but right now we're using Denticon and it works really well. As soon as I have those x-rays loaded up, I could, in realistic reality, be able to be like, hey, doctor, so-and-so, they're up right now. Can you take a peek at those? Can we do and we have done some synchronous teledentistry visits, but we also do a lot of asynchronous, right? Because if there is obvious signs of decay, I need to get them in. If there is no obvious signs of decay, and I'm talking like kiddos with wonderful, wonderful, clean, beautiful teeth, no obvious signs of anything going on in here, then I'm still going to take extensive photos. I'm still going to take those x-rays and I'm still going to do my dental hygiene assessment and send all of those detailed notes to my teledentist to review. If there's anything that I've missed, maybe there's a little small sign of an interproximal, something going on in there, she can let me know, oh, we want to address this with this, or maybe we want to do a little SDF right here. Maybe we should be a little bit more aggressive with that. And I want to see them again in 6 weeks and reapply. It looks different for each, but that is the cloud-based system that we're currently using. And it's been pretty fantastic. I really enjoy it. Let's move over to our next slide, please. So what does that look like? If you are at NOHC, yes, these are some of the same slides, but this is one of the locations that I'm at most of the time. This is a pediatric medical clinic. It's one of what we call a co-location because we are co-located with our medical providers there. At this location, we have pediatrics, which is where I'm located in that hallway. We have family medicine and internal medicine. As part of our team to offer that holistic care and value-based approach, we also have our behavioral health workers, our psychiatric health workers. We have our diabetic wellness team, and our nutritional counselors as well. And so that way we can really work together to make sure our patients are getting the care that they need. It's a very fluid place that I work at because it's wonderful. They are one of the first places of our community outreach teams to allow us to be integrated into their medical health records. I have completed all of the onboarding as if I was an employee, all of the HIPAA, the confidentiality, all of the different agreements that would be required of an employee of their location. I have completed in order and signed an MOU in order to be able to have that business agreement, whatnot, so I can see within that health record, do documentation to that health record. Unfortunately, our health records do not intermix, which means that it's not a full integration. We haven't reached that level 4 if you're in the know on those integration levels, depending on which one you're looking at. But it does allow me to double record, right? I'm leaving that note so that the doctor that comes in and says, oh, I wonder if they saw their dental provider recently, I can leave a little blurb in there for that. And then I do a more comprehensive one inside of my dental records. So for this one, I also offer not just our same-day care visits, or like if somebody comes in for their well child visit with their pediatrician, I can do what's called a pop-in visit. It's where a lot of times I have a doctor that'll knock on my door and be like, yoo-hoo, I have a patient in here that hasn't seen dental yet, or I have a concern, would you mind coming looking at it? And I throw my loops on and a mask, grab my disposable mirror and some fluoride, and out the door I go. I also have a little tiny pad. It's not a prescription pad, but it's like a little thing that I can check off the box how much time they would need if they were to schedule with me, and I can give that to them that they can take up front to schedule after. And that's part of that care coordination component that has kind of streamlined that process. I do those pop-in visits. They take about 2 to 5 minutes, and it's typically right after the doctor has left the room and right before or as the MA medical assistant is preparing their vaccines. So it's this perfect little sweet moment to get in there and get out. We can talk about the nitty-gritty, focus, do some really focused OHI, and then they're able to take that slip up front, and then they get immediately scheduled with me, or I reach out to them if I don't see that they've scheduled. So being in the medical clinic, reducing barriers to care, reducing how much time my patients have or their parents have to take off of work because they can get those 2 visits done at one time. I have a full column that I run there on my own of hygiene services. So I can complete their non-surgical periodontal therapy quads while they're there. I can do their prophylaxis, whatever is needed dental hygiene wise. If they're in a nice stable place, no signs of cavities present, I can, like I said, do all that documentation, and we can do a teledentistry visit. Yeah, it's a fantastic location. I love this place, and I love all of the people that I get to work with. I'll give you one little example of a story of someone I've worked with here. So when I was working here, I have a sweet little family that came in. They had just immigrated to the United States. Their primary language is Vietnamese, and father had just passed away, unfortunately, suddenly. And he had been the one that had created all of the appointments. Mom showed up, and with 2 little ones, both in how do I say this? They both had rampant signs of caries present. And it was really hard to see. Both had really high anxiety, and both also didn't speak any English as well. We were able to get interpretive services immediately in. We were able to get them connected with care. Unfortunately, one of the children did require general anesthesia because they had such extensive care, but we were able to get that started. We were able to start those preventive visits for little sister. And mom was so thankful for that she also was like, you know, I've never been able to do it. I've been too scared, but you've taken my anxiety away. I want to get my teeth done. So I offer holistic care. I said, come in and see me. So it's family care, right? If I'm seeing signs of something going on in kiddo's mouth, then there's probably a good sign that there's something going on in parents' house, in parents' mouth. And so we get to do full family oral hygiene instructions. We get to work together. We get to come up with plans. We get to utilize motivational interviewing and allow them to come up, be a part of that process of developing a plan that works for them. That family has been with me now for 3 years, has been cavity free, and is doing great. So that's just one example of one of the families I work with. We can move to the next slide. Sorry, I don't have a timer. How am I doing on time? Looks like we're doing okay.
You're good. You're
Awesome.
good, Lisa, keep going. It's
Yeah, thank you.
fascinating story.
I have so many stories that I can get lost, so please feel free to cut me off. So this is one of our school-based health center locations, or I guess there's 2 of them shown on here. So similar to like an integrated medical clinic, we integrate into school-based health centers. Now we're not a federally qualified health center. We are DCO. And so it looks a little different for us to go in. We, have more paperwork to sign, but we're willing to do the work, right? That's part of what community outreach is. We adapt, we are solution focused. So we find barriers and we figure out how to work around that so we can get patients at the care that they need. So similar to our medical environment, we either have a permanent chair like I do at one of my school-based health centers in Yamhill County. I have a full chair set up, full operatory really, that I've got set up in there. It is mobile, but for that location, it stays there. And it's right located in the high school parking lot. So patients, once they reach a certain age, that they can go ahead and do their own care, or if they have a note from mom and dad and there's minor authorization, all of the fun things approved, they can actually walk over for their care. And it's fantastic. A lot of times we'll do it at lunch hours, at their school break, during their study period, study hall. So that way these kiddos aren't missing as much school hours. Parents aren't missing work hours. We're able to get them in for the care that they need. For some of these, we will do hygiene services as something that we do weekly, but maybe we have a dental van that shows up once a week or maybe once a month to address those more restorative care needs. We are just working hard to really increase our communication between our medical providers, our parents, our patients, all of the school staff. If there's a kiddo that's really struggling to focus on something, maybe there's dental pain going on. Let's just ask a few more questions, make sure that they're getting care that they need. At one of the school-based health centers that I work at, we also have our behavioral health team. For one example here, I had a patient come in chair. It was supposed to be 2 siblings coming in at the same time, brother and sister. Only sister showed up. Mom and dad were present, but mom, after signing paperwork, fell asleep against the wall. Everybody you could kind of get a sense was a little stressed. I asked sister if everything was going okay, and she said, well, my brother's in the emergency room right now because he attempted suicide. It was heavy, but in that moment, I was able to talk with her, utilize the trauma-informed trainings that I have received, and was able to call in a warm handoff directly to our behavioral health team, who was able to come in and just ask the hard questions, get them immediately connected with care. These are both of those patients, both the brother and sister, are patients that I have continued to see for the last 3 years. And both are doing well. But having that immediate ability to work in conjunction with others, that integrated medical, dental, behavioral health, so important, right? And so helpful. In that moment, that sweet girl was like telling me, how I'm feeling right now is not important. My brother's what's important right now. He's who I'm worried about. And I said, honey, we're going to make sure he gets the help he needs too, but you're important too. And how your experience is going through this is important too. And all of those things going on, we think, oh, well, that's behavioral healthy. So what did you have to do with that? Well, yes, I was able to connect them with services, but as we also know, when mental health issues are coming about, sometimes oral health is the last thing people are thinking about. So I got to come up with plans that work for them to be able to maintain their oral health. For one of them, they were really struggling with actually getting up and brushing their teeth. So it just meant having some disposable toothbrushes next to their bed. right? So we're trying our best to find ways to help everybody that we can, being creative, working with them. And my expanded practice allows me to do that, and allows us to go into these places that are otherwise would be limited, correct? So also at school-based health centers, I'm using a lot of teledentistry. Sometimes that means that a teledentist is going to be doing an exam on a patient that has obvious signs of decay present. But what that means is it's lowering the amount of visits, the touches that are needed and required at my local office, because my teledentists are calibrated with my local offices. My patients also know that just differences between dentists and dentists, we're going to have a possible slightly different restorative plan, right? That can happen in the same office with a dentist standing next to each other, right? So I let them know, like, this is your initial diagnosis, this is your initial plan by your teledentist, please head over there, and then they will give you a more detailed, but it gives a heads up for our dentists there. And a lot of times they can offer same day care now, right? Because they can just simply confirm what they are seeing as well, and then offer that care. So reducing the amount of visits, which is super important. Some of the equipment I use, just a quick one, is I have a small wagon that I carry all my sterile supplies in for the day. I've got a compressor for my air, water, and hand pieces. I use a handheld Nomad for my x-rays. Sometimes I use a foldable chair, which you can see at the lower left photo there. And I use a Freedom handpiece, which allows me the freedom to utilize that and move around with it. And sometimes I can even take it to, say, a medical room or whatnot to help with that. At these locations, I not just do fluoride varnish, but if it's approved and consents are completed, then I can also do silver diamine fluoride applications as well as a preventive medicament. If you want to go ahead and move to the next slide. Thank you. So this is one of our hospital integrations. This is one of our hospital co-locations. We are piloting 3 critical access rural hospitals, and we're providing services in the emergency room, inpatient care, as well as obstetrics. And some of the services we're providing is limited hygiene services, because I mean, if you're in ICU or you're in the ER, some people just don't really want to get their teeth cleaned in that moment, but limited hygiene services, right? And some of that, we're offering education. We offer diabetes education. Sometimes we even partner with diabetic education courses that are occurring at the hospital level to insert that oral health component to it. And nutritional counseling, we partner with them. And then also we offer teledentistry. So as you can imagine, this is truly individual-based care because what you're doing is changing daily. You don't know who you're going to see because patients might be there for 4 hours or 4 days. And so it's completely individualized. It's not an easy one to show a workflow because it kind of depends on where you're at, which hospital you're at, what their workflow looks like, what their charge nurse wants to do, that sort of thing. But a lot of times our hygienists are part of the rounds process, grand rounds. And during that time, we're able to triage, okay, these are the patients that are in need of some oral hygiene services. And this is the times that they're going to be here. This is the time a provider is going to be in here. So why don't you check it out during this window? So yeah.
So we're just about out of time for your presentation. So if you have any other things you want to include, please do, and then we'll move on to Nicole.
Yeah, I'll just briefly go through the last couple. This is our behavioral healthcare clinic. So I've already kind of talked about how that works, but we do have dental vans that have full operatories. We have one van that has a panoramic radiograph imaging possible. So we can do that for our patients that require that. And if we move to our next one, this just kind of talks a little bit more into detail about teledentistry, and I'm happy to send some of these slides over to you if you want to check more about it or you have questions about it. I know teledentistry is one of those things that a lot of people have a lot of questions about. I'm happy to answer them, and my email will be at the end here. If we want to move 2 slides down to my community health worker slide, this is something new that we've been kind of rolling out in our company, is our dental community health workers, really helping with the care coordination process, really helping to reduce barriers to care, helping aid our patients with care navigation. This has been the heart of our team, and we don't even know how we operated without them. I wish we had time that I could share more about them and what they do, but it has been amazing, and I'm looking forward to speaking about this more in the future with some of them. And then if you want to move 2 slides down, I've already shared a few stories, so I'm going to skip the story slides. If you have any questions, my email address is right there, balintl@interdent.com. I'm happy to talk about our workflow processes, because sometimes it's talking through what you're seeing and what you need. And I like to inspire others that even if you have a smaller scope of practice, there's still a lot that you can do. And it may require some out of the box thinking, but it is super important that we're getting out there, that we're reducing these barriers to care and increasing access for our patients. So yeah, thank you so much for having me.
Very good, thank you. So next up, Nicole Ferrian.
My name is Nicole Ferrian, and I am Appletree's Clinical Innovations Director. What I'd love to do is share my presenter mode, but for whatever reason, this is over the button, so I can't. I graduated from Minnesota State University, Mankato, with a bachelor's degree in dental hygiene and a master's degree in community health. I started my career as a dental hygienist in private practice, and then after obtaining my master's degree, I moved into a clinical and administrative role at the University of Minnesota School of Dentistry. I then moved into a leadership role at Delta Dental of Minnesota, overseeing their Medicaid and Medicare programs. And a few years ago, I moved into Appletree, and as I mentioned, am their Clinical Innovations Director. I practice clinically in community settings, and then also work in project management, operations, and a whole host of others, billing, administration, etc. Our agenda today includes collaborative dental hygiene practice in Minnesota, how dental services can be delivered outside of the brick and mortar dental office, creating access to care, similar to what we just saw, and then just next steps in terms of what Minnesota is working on. We operate by a community collaborative practice model, and this essentially meets people where they're at. So we talk about, as you can see in the slide, schools, nursing homes, health and social services. So it relies heavily on our collaborations with partners such as medical clinics, counties, cities, and payers, others, just to be able that have the shared mission to be able to provide services to the underserved. Collaborative dental hygiene practice in Minnesota enables hygienists to deliver care outside of the brick and mortar setting. Minnesota's innovative use of dual license providers, also known as dental therapists or advanced dental therapists, help accomplish this goal. Collaborative dental hygiene practice in community settings, as you can see here with the statutes in Minnesota, authorizes Minnesota licensed dental hygienists to practice with a community-focused model, which results in more access to care. There's a link below, and this talks a little bit more. I don't want to read the slides to you, but I just wanted to give you an idea of where I got this information in case you wanted to learn more at a future state. Some of the key points about collaborative dental hygiene practice in Minnesota include that it was introduced for community and it's not necessary in a brick or mortar setting, and that there is no additional education or credentials needed in order to be a collaborative practice dental hygienist. You just need a doctor to work with that you'll engage in a collaborative practice agreement with. And it's just emphasizing that it does not authorize independent dental hygiene practice. Again, included a link there for more information. So now we'll jump into community settings in which we, as hygienists, provide care. Appletree offers various services to long-term care centers. So we sometimes will contract with the long-term care facility to have dental hygienists provide regulatory required dental screenings to residents instead of having their nurses do it. So we have a certain mileage around our brick and mortar centers because we operate by a hub and spoke model that we have these services offered. We'd like to go throughout the state of Minnesota, but with our 9 centers, we just don't have the capacity or staffing model to be able to do that. So currently we provide screenings and comprehensive care, typically 1 hour from our brick and mortar centers. As you can see here, we use mobile equipment when we do provide comprehensive care. It's the same type of equipment that we have in clinic, except for it has wheels. Here's just another picture. So there's a dentist here as well. Like I mentioned, there's just different ways that we deliver care in the community. Screenings is one of them, where that is primarily done by just a dental hygienist. But when we provide comprehensive care, we have the whole dental team present. Appletree is also collaborating with the Minnesota Department of Health on an Aging and Oral Health HRSA grant. The focus of this project is primarily staff and resident education to promote better oral health for residents. And so what we're working to do is we've identified 2 long-term care partners, one in Greater Minnesota, or I'm sure they're both in Greater Minnesota, one is Northern, one is Southern. And we are understanding the current education level of staff and then providing best practices and education to both facility staff and residents so that we can improve oral health among the centers. This is just a brief overview of the partners. As I mentioned, Lakeview Methodist is in Fairmont, that's down in southern Minnesota. We already provide comprehensive dental care on site using our mobile equipment. And then Appletree also has a brick and mortar clinic inside of the Mayo Medical Clinic building in Fairmont. So access to dental care for these residents is not an issue. However, our focus of this project is oral health education for the staff, and so that they can better serve their residents. Our other partner is Oak Hill Assisted Living in Grand Rapids, Minnesota. That's located in northern Minnesota, where dental access can be tough at times, especially for those on Medicaid. There aren't any community clinics in that area, and we do not offer on-site mobile care either. So it's even more important that in this space that facility staff are well educated and trained on oral hygiene instructions so that they can help their residents promote better overall oral health. We've met with leadership and at the facilities, and then are also working with staff to perform key informant interviews so we can better understand what the oral health education level is. And then we've designed custom trainings focused on oral health instruction, so brushing, flossing, rinsing, nutritional counseling, dental care, and then oral health's overall impact on overall health. So sometimes what we hear in facilities is, well, they're older. Does it really matter if we take good care of their teeth? And there's a lot of education that's needed in terms of how oral health affects systemic health, and then also how good oral health promotes a quality of life. So another place in the community that we render care is at Head Start centers and schools. Today, I will focus on Head Start centers, mainly because that's where I provide care, but there are several places that we go into schools and provide comprehensive care utilizing the mobile equipment that you saw in my presentation earlier. The goal of the work that we do at Head Start is to provide education and preventative services to all the children at Head Start and help the children with restorative needs access treatment within an appropriate time frame. Most of the students at Head Start are 3 to 5 years of age and have not been seen by a dentist. I wanted to just provide the workflow here so that you can understand how it typically works. And the dental hygienist comes into the Head Start Center, and the focus is all children. So oral health education, oral hygiene instruction, and nutritional counseling is provided to all of the kiddos, and then their parents, if their parents happen to be on site. Mainly we go during the school day when it's just the kids, but there are times when we've gone to orientations, etc., where parents are present as well. Preventative care, so a screening, a toothbrush prophy, and a fluoride varnish is also provided. And then an asynchronous teledentistry exam is performed, so a store and forward, so that a dentist can do an exam and then provide a recommended treatment plan if it's needed. just to give you an overview of percentages of children that are healthy versus restorative needs. And of course, each location is different, but typically what we see is that approximately 30% of the children have active decay, but less than 10 of them have urgent care needs. And then children that are identified with concerns typically need 1 to 2 visits with just a general dentist. Appletree does employ pediatric dentists, and there are times that a kiddo's oral health status is so severe that they do need to be seen by a pediatric dentist under sedation. I wanted to put a few images here so that you can see what it looks like when we are taking images for asynchronous teledentistry. So on the left here is an intraoral camera, and those capture individual images. And on the right, I'll get into this a little bit more. We've started to use technology called a grin scope, and it uses an iPhone to do a full mouth scan. So it captures a video and then also additional still images to send back to the providers. And our providers really like those because it helps them better identify the tooth numbers. So here's a set of what intraoral images look like that the hygienist may send to the dentist to with the screening, just to visualize what's going on and help create a treatment plan as needed. And then this is the grin scan that I was talking about. So you can see that there's a scope that attaches to a phone, and then the scope, they make different sizes. They go into the child's mouth, and it creates an entire scan. So there's a video scan and then those still images that I mentioned. And then the dentist reviews the images, or advanced dental therapists in Minnesota can also diagnose for exams back at the office to put together that treatment plan. And then our care coordination team follows up with the family. So in terms of next steps and where we're headed, Minnesota understands that access to care is needed, especially in community settings and in greater Minnesota. So Minnesota has focused on collaborative practice dental hygiene and also community care settings for dental care in their state oral health plan. So here is just a snip of some of the things that we're focusing on in Minnesota. And it's just really understanding that there's still issues to work through. Some of those examples include reporting. So right now we do have collaborative practice dental hygienists out in the community, but when they are sending in their claims, so for encounter data, reporting, et cetera, there's not a uniform way that's done that it's acknowledged that it's by a collaborative practice dental hygienist. So for example, what could happen is if a dental hygienist had their own NPI, if they build themselves as a treating provider and then use their collaborative practice dentist as the billing provider, that would enable us to be able to see in the encounter data how many kiddos or people that collaborative practice dental hygienists are seeing, but that's not currently a requirement. So that is an area to work through. And I know we've talked about teledentistry here a lot today. And so it may seem that it's very commonplace, but at least in Minnesota, there's a lot of work to be done still in terms of using teledentistry to reduce barriers of care. And so there's lots of promotion to use teledentistry in long-term care, Head Start, et cetera, so that we can increase access to care, especially in rural communities. Also, the promotion of medical dental integration, like we talked about earlier, using teledentistry, collaborative practice dental hygiene, silver diamine fluoride to arrest decay that's found when a dental hygienist is out in the community, and then also fluoride varnish for prevention purposes. More focusing on this and the inclusion of all of those activities when out in the community will better create good oral health for all of those, especially in the community settings. Now I just have my information here so that you have my email address. Feel free to contact me with any questions. And that concludes my presentation.
Great, thank you so much. Very interesting. So next, we're going to hear from Donna Hickey, who is at the State Dental Hygiene Association, to talk about where we are in New York and where we think we're heading. Donna?
Okay. Hi, everybody. I just want to start with saying the two previous speakers before me has given me a lot of hope, a lot of hope. New York is tough. New York is a tough state, and everything we get with grit. But I am very happy to say that we are the farthest we have ever gone with our collaborative practice bill. It was signed by the Assembly. Unfortunately, we have run out of time, so we will have to restart again when the government opens up. But here's the thing. We're working collaboratively with many organizations. There's a huge chorus of voices that have invited the New York State dental hygienists to the table. They're working with us. They come to us and ask us what we think. Our collaborative practice bill, as it stands now, will allow us to go into a hospital as defined in an Article 28, public health, appropriately equipped school, federally qualified health center, long-term care facilities, home servicing people with intellectual and development disabilities, violent shelters, school. I mean, everything that we've discussed today, it's going to really open up the access to care in New York. The problem of access to care. The difference is, and I found this interesting, is I believe it was Nicole that said, as long as they have a doctor signed on, that they move forward with the collaborative practice. Here in New York, what we did, and like I said, it was accepted and signed on and passed the Senate already, is we've tried to combine the dental therapy bill and the collaborative practice bill into one to enable us to go into all these settings. We're waiting on the State Board of Dentistry to find out where we're at with the teledentistry. That's definitely on the horizon, for the whole country, I believe. And then, block anesthesia. We're right there. I believe, that's going to be next for the New York State dental hygienists. But again, our big push is towards collaborative practice. And when I listen to Nicole and Lisa talk, I really am hopeful. It is about the patients. It is about the access to care. And we know in New York, we have a very big need for it. And we're here, we're skilled, we're able to do it, we're willing to do it. And I think we're gonna get it done. I really, really do.
Great.
Yeah, I just want to be more positive because we've never gone this far before in the state of New York. And we have a lot of people at the table, a lot.
And Donna, I really think that having all of the stakeholders that are working with the Schuyler Center around strategies to improve access to care is really helpful. I think that there are many groups looking at this from many different perspectives who are very committed to helping expand access to care, and dental hygiene scope of practice is clearly one of the things we can do that, quite honestly, I think is low-hanging fruit.
Oh,
in
yeah,
terms
it's there,
of,
we can taste it. We can
Yep, I hear
absolutely.
you. So we have a few more minutes. Does anybody have any questions for our presenters? Any questions at all? Okay, then. Looks like it's a wrap. Well, thank you, everyone. This has been really enlightening, and again, exciting about the possibilities for moving ahead in this area in New York. So take care. Have a good day.